Thank you very much, Presiding Officer. This week, Margaret McCaul from Lanarkshire described her ordeal when she was diagnosed with ovarian cancer. She faced a 3-month wait for NHS treatment in Scotland, and Margaret didn't know if she had that long. So she used £27,000 of her life savings for faster private treatment in England. Margaret said this: "Cancer kills if left untreated, and the Scottish Government is allowing this to happen. We shouldn't have to go to London or elsewhere." First Minister, Margaret's right, isn't she?
First Minister.
Margaret is right that nobody should have to feel that their only option is to pay privately to go anywhere else outside of Scotland for cancer treatment. And can I pass on my sympathy to Margaret for what is an unacceptable ordeal that she has had to go through. If I can try to give some context, I know Douglas Ross and indeed others in this chamber and outside of this chamber are aware of the significant impact that the COVID pandemic had on our health services right across the UK, including on cancer services. I think one of the most difficult decisions this government had to take during that COVID period was, for example, to have to pause screening, cancer screening, for a period of a number of months, and we are still dealing with the impacts of that difficult decision. In terms of ovarian cancer more specifically, let me try to offer some assurance, if I can, in terms of the latest figures, that in Scotland 94.7% of women, so over 9 out of 10 women, are receiving their first treatment for ovarian cancer within 31 days of a decision to treat. That's as per the latest figures. But in those situations where that is not happening or has not happened in the case of Margaret, then I fully accept Douglas Ross's proposition that that's not an acceptable state of affairs.
Douglas Ross.
The First Minister, as I thought he would, mentions COVID, but they had COVID in England as well, where Margaret got treatment because she could pay £27,000 for that. She went south of the border to get it. And the First Minister wanted to offer his reassurance to ovarian cancer sufferers. So let's look at what Target Ovarian Cancer has said. They say Scotland has one of the worst survival rates in Europe for this cancer. People need urgent treatment to save their lives, but in the SNP-run NHS, they wait months. And Margaret is worried about what happens if her cancer comes back. And she's also worried for people who don't have life savings to pay for treatment. Public Health Scotland statistics show that people from the most deprived areas of Scotland are 74% more likely to die from cancer than those in wealthier areas. So, First Minister, what are people meant to do if they get cancer and they can't afford to go out with Scotland for their treatment?
First Minister.
Well, the NHS in Scotland will be there to assist and to and treat where they possibly can. Unless I misunderstood Douglas Ross, and I'm willing to correct the record if I did, my understanding is that in Margaret's case she went for private treatment in England. So, of course, the services in NHS England are also being impacted, as have the services in NHS Wales, as have the services undoubtedly in NHS Scotland. Douglas Ross is absolutely within his right to ask the question around ovarian cancer. I'm more than happy, given the time limits that we have in First Minister's questions, to write with him with far more detail, but we are taking the issue around ovarian cancer specifically, as he's asked about that, with the utmost seriousness. The Scottish Cancer Network, excuse me, Presiding Officer, will be establishing a new ovarian cancer clinical network which will ensure equity of access to treatment for all women with ovarian cancer, and that's specific to the point that Douglas Ross raises around the inequality that may exist in relation to accessibility of services. We've also committed £10.5 million to health boards to improve capacity and access to systemic anti-cancer therapy by 2027, with £3 million of additional funding released this year. As I say, there is a lot more I can say in terms of detail of what we're doing specifically around ovarian cancer, but in the interest of brevity, I will write to Douglas Ross with that further detail.
Douglas Ross.
Well, I'll welcome that response when it comes, and I'll share it with another member of the public we've spoken to. We spoke to Irene Hartshorn from Ayr, and she was told she needed to wait 12 weeks for ovarian cancer surgery. She told us this morning, and these are Irene's words, "I felt powerless. You know that all the time the illness is getting worse and worse. If I had waited, I think I would be dead by now. Her sister paid for her to get treatment in London, but Irene wanted us to ask the First Minister this question. First Minister, why are the resources not in place in Scotland for this kind of treatment that Irene had to go south of the border for?
First Minister.
Well, we are investing in our National Health Service. That's why this year we gave an additional £1 billion to the Health Service, taking it to £19 billion. So we are not just investing in the Health Service, but importantly investing in the people that provide the treatment. It's why we assured that we did everything we possibly can to ensure that they were paid fairly and that we didn't lose any days on the NHS to industrial action. In terms of staffing as well, under the SNP, there's been an almost 100% increase in consultant oncologists since we took power. So we are investing in the individuals in our health service. We are investing in ensuring there's early detection of cancer as well with our rapid cancer diagnostic services. And we are specifically on ovarian cancer, as that's been an issue that's been raised by Douglas Ross. We are seeking to do what more we seeking to explore what more we can do for faster treatment. I go back to the latest statistics that were published, which I hope provide some assurance, though I accept fully their cold comfort for those who've already had to pay for treatment, but to provide some level of reassurance. The latest statistics show that 94.7%, almost 95% of women are receiving their first treatment for ovarian cancer within 31 days of a decision to treat, and we want to consider what more we can do to improve that figure further.
Those answers will be so bitterly disappointing for Margaret and Irene and hundreds of others that are so distressed at having to pay so much money to go out with Scotland to get their treatment. The experts are echoing exactly what the patients are telling us. Dr Hume of Cancer Research UK said the problems in cancer care are fixable if the new cancer strategy is fully funded and implemented now. But the evidence shows that the resources are not in place. And official statistics this week showed that 1 in 4 Scottish patients suspected of having cancer don't start their treatment within the 62-day target. And a new Freedom of Information request that we've had answered shows that one patient in NHS Grampian this year has waited 156 days, more than 5 months, to start chemotherapy. Humza Yousaf was Health Secretary for 2 years and cancer waiting times grew. He's now First Minister. What's he going to do to sort it?
First Minister.
Well, as I have referenced, the 31-day cancer stat has improved in terms of the previous quarter. So that's showing, I hope, a journey of recovery that we're absolutely on. And we have to accept that recovery will take a number of years. Douglas Ross made a few points, actually a number of them of which I agree with, and he was reading on behalf of those who work in the NHS, that the cancer strategy, the 10-year strategy that we have published, must be fully funded. We agree. We accept that very premise and that very point. So that's why, for example, this year we've increased our investment in the health service quite substantially. And of course, later this year we'll give an update for our budget 24-25. But I accept fully the premise that the strategies we bring forward must be funded. I also accept the point that the 62-day target must be improved. There is no doubt that that has been impacted and affected by the pandemic, but there frankly was challenges around the 62-day target pre-pandemic too, and that's why the cancer plan, the cancer strategy we have, will seek to target those cancers, those cancer types that we know we've traditionally struggled with in relation to the 62-day target. So from a Scottish Government perspective, we'll continue that record investment in the NHS. We'll make sure our staff are paid fairly, and we'll make sure we continue to have adequate staffing within our health service. But let me give an absolute assurance, not just to Douglas Ross, but to all of those who are watching and listening, that the treatment of cancer, early diagnosis and then the early treatment of cancer is an absolute #1 priority for the government that I lead.